Hey Preceptors, welcome to the fourth week of the fall 2019 semester. It's crazy that it's already been a month that you guys have been assigned in place with your students. So hopefully things are going well, you're starting to establish a routine and kind of have some nice good open communication, and they're getting really good experiences. So this is the bi-weekly announcement to kind of give you a breakdown of what's going on our end of things and just a touch base on some stuff. So first thing, assignments. All the students turned in their contracts and their expectation assignments on time, so thank you for that. It's really great that they were able to do that. Also, as I read through the expectation assignments, it was evident that you guys are really dedicated and motivated to providing quality clinical education experiences to our students, so thank you for that. I just feel really, really blessed to have great preceptors like you guys, and so it's just good to know that, you know, the students are in good hands and they're getting those quality experiences, so thank you so much. I'm very excited about the rest of the semester that they have with you guys. Courses, first years are in their assessment class. They just started ankle assessment. They're doing palpations, and then they'll be rolling into special tests, range of motion, and everything. So if there's an opportunity to do one, give it to them, or work on palpations and things like that related to the foot and ankle. And then they'll go in order. They'll do foot and ankle, and it'll be knee and hip, and then they're going to go right up. So they're going to be making progress in that pretty quickly. They just went over bracing and some specialty durable medical equipment and spine mobilization in their integrative course. So if you have braces or something that's unique that they might not have seen that's normal, you know, pulling them out, exposing them to that, or having them just, you know, take something and fit someone with something just for the experience because they haven't quite had that yet. And then working on those spine mobilization techniques, you know, if you had downtime or something related to that. In therapeutics, they are starting the inflammation and healing processes. So don't be surprised if they are asking you like, well, how do you manage, or what do you do for acute care, or, you know, immediate care related to pain management or swelling? Because we're gonna kind of initially talk about RICEs, and we're gonna probably debunk a lot of the myths. So don't be surprised if some of those conversations come up, and or provide that as an opportunity for you to get information from them to update yourself if you haven't in a while, like what's new, what does the research show kind of related to RICEs. Second years, they are in their organization administration class. They just covered leadership, and then they're moving into finances and budget, inventory, things like that. So this would be a great time where they could, you know, assess their current situation, setting at they're at, talk about the budget, talk about finances, talk about how that's managed, how you determine, you know, whether you should buy this or that, or whatever type of system or inventory you have, because they'll be interested to learn about that. An integrative course, we just finished doing some manual therapies or doing joint mobs this week, and we did just cover physical exertional emergencies last week. So rhabdo, exertional sickling, hyponatremia. They'll have comps on those things, so those will be coming up. So either working on those manual therapies again if there's downtime, and or maybe going through some scenarios related to the physical exertional stuff. And again, this is a great time where if you guys feel like you haven't quite been updated in those areas, use your student as a resource to go ahead and say, hey, what did you learn? You know, I don't remember covering rhabdo when I was a student. Let me know. Update me. Give me information. And that really kind of gives them some independence, some autonomy, and it makes them feel like, wow, like my opinion matters. And so that's a good way that you can show that, you know, that relationship's reciprocal, what actually helps with their confidence and allowing them to initiate some things. In their research or evidence-based practice course, we just finished covering how to develop clinical questions, so like PICO, or what is now PICOT questions. We also talked about types of research and classifying them, study designs, and then rating them in those levels of hierarchy. So don't be surprised if they are coming to you saying, you know, how do you develop a clinical question, or how do you have a situation, come up with a question, and then start searching the literature, and how do you gather that and read through that and determine that? Because in the next couple of weeks, they're going to start searching the literature and doing all of those things. So don't be surprised if they ask you kind of how you implement evidence-based practice into your everyday. So that's for it for classes. Evalu, things look good. Hours, patient logs, everything's going fine with that. That's not a problem at all. Site visits. So if you're an active site, I do come out once a semester to visit the active site. I usually like the students to get their feet wet for a little bit, so I usually won't start even scheduling things till the end of September. So probably in the next 2 weeks, I'm going to reach out to you guys and say, hey, I'd like to stop out and do a site visit, and we'll schedule that and get that on the books. And I'll probably stop out anytime between October, November-ish. So we might schedule it super far in advance, but we'll be doing that soon. And then we also got a reminder from Katie as far as just information to disseminate to all of our sites, seeing as how just to ensure that we're interpreting definitions properly. Don't forget that preceptors are any healthcare provider that is licensed and certified according to their credentials. Now for us, for students, if they're going to be evaluated by that preceptor, they have to be an MD or an athletic trainer, and they have to have proper preceptor training. All right, so it's okay if they work with another healthcare professional here, there, off to the side, but as far as the person that's evaluating them, doing the days in and the days out, that needs to be a certified athletic trainer or physician that has had preceptor training from our program. So if you're not sure, contact me and I can help provide clarity with that. Also, Katie wanted us to re-hit supervision, so don't forget, supervision means that you are able to intervene on behalf of the patient if there was something. So the student can be doing something, but you need to be in a place or presence where you could stop that from occurring. So we know that, there's no longer covering practices by ourselves or all that stuff, that there has to be that supervision. So just make sure that you're around. But that doesn't mean you have to be right there on their shoulder, but paying attention to that. So Katie just wanted us to hit those things again. And then we're going to end today with a learning tip, because I like those. So this was some findings that I had from my dissertation, and I talk about them at preceptor training, but sometimes there's not enough time. And so I feel like now's a good time to hit this again, because it's about week 4. So you guys are either starting to develop really good relationships, or maybe you might hit a part where I'm kind of struggling with the relationship I have with my student, what that looks like. So I thought this would be a good idea. So out of my dissertation, when I did qualitative research and I examined preceptors and students to examine what engagement looks like in clinical education. And so one of the findings was this. So as you can see, there's this model. So we have comfort up here, and then comfort, initiative, opportunity, and then the middle is engagement. So long story short, what preceptors and students said, they said that if I felt comfortable in that relationship, that would make either me or my preceptor want to initiate. And when they initiated, there was an opportunity for the student to learn, to do something, demonstrate competence, and then they learned something. And then initiation would happen again. So if you're able to develop that comfortable relationship, someone would initiate, there'd be an opportunity, initiation would come again, an opportunity, and we'd kind of have this continuous circle. So, and everyone defined the comfortable relationship different. They're easy to talk to, we have similar sense of humors, they understand me, they listen to me, there's various things that define that, but if they have that comfortable relationship, opportunities were presented. And so this is important, because then this ties to the next theme, and so this is a bigger one, so as you can see. So we have trust up here, we have comfort, so this relationship that we already talked about. So comfort's there, and opportunities presented, and then so that means the student's doing something, and while that, you, the preceptor, you're assessing them. Are they really doing that ankle evaluation okay, right? You're determining if they're competent or not. You're watching from a distance or up close or whatever, right? But you're doing some form of assessment, right? So you're determining if the student is competent or not. If the student is competent, then you go down here and you establish trust. If they're not competent, you're going to give them another opportunity. You're going to assess them, determine competence. Yes, if they are, that second time, trust. No, you'll go back up and you'll kind of repeat that cycle. So pretty much once competence is achieved, you have trust. And what I found was that trust led to deeper engagement. And deeper engagement was defined as learning new information, being provided more autonomy to do things on their own, or advancing their skill set. Maybe doing, if I did part of a ankle evaluation, doing the whole one alone. Or maybe you went through and they demonstrated competence in determining the grades of joint mob. So now the next level is they can do, a grade 2 on a patient. So we just were able to determine that if there's a good relationship, the student's going to get an opportunity to do something. You're going to assess them, and you're going to keep assessing them, and that's going to keep happening until you determine trust. And when you determine trust, That's defined as deeper engagement. And that is when students are doing that critical thinking and that clinical decision making, which is really, really important. So if you're not quite sure or how to kind of establish that relationship, those are just kind of things to think about. Reach out to me, I can give you some tips, but focusing on really having that nice, good, strong preceptor-student relationship is the number one factor that influences clinical education experiences. So yeah, food for thought. You're all great. Thank you for doing all that you do. Sorry that the video announcement is a little bit longer this week. But if you have any information, or if you have any questions or need anything, just let me know. Thanks, guys.